Welcome to this video. So in this video, I'm going to introduce you to the major courses that you are likely to encounter in your second year as a medical student, especially for MBChB student, which is Bachelor of Medicine and Bachelor of Surgery. So I'm going to explain what each course is about, and most importantly, what you should expect as a new medical student. So we have four major courses, but you'll be taking five courses in total. So what are these courses? So the first course is anatomy. So anatomy. The second course is physiology. Third course is biochemistry. Then the fourth course is public health. Public health. So these are the major courses that you'll be taking. But in total, as MBChB students are going to be taking five courses. So we have additional one, which is the fifth one is behavioral science or behavioral and communication. So behavioral science. Yes, so behavioral science. So now let's get started. So we're going to start with anatomy. So I'm going to explain what anatomy is all about, as well physiology, biochemistry, public health, so that you know what to expect. So let's start with anatomy. So anatomy. So first, what is anatomy? So anatomy is just a study. Anatomy is just a study of the human body, or rather, study the study of the structure. Let's put it as a structure, study of the structure of the human body. So this is all about anatomy. You just study different structures of the human body. So we are going to talk about things such as where these structures are located, what they look like, and how different structures are able to relate to each other, which is relations. So in anatomy is further divided into. So I've got three subs for anatomy. So one, we have got gross anatomy. I've got histology. Also, I've got embryology. Embryology. So I'm going to break down what gross is all about, histology, and also embryology, just in a nutshell. So gross anatomy. So let's start with gross. So gross anatomy, you're just dealing with structures that can be seen with our naked eyes. With the naked eyes. So any structure of the body which can be seen with our naked eyes, that's gross anatomy. That's gross anatomy. So now let's name different structures that you can able to see with our naked eye. So, for example, you can see bones, able to see muscles, been able to see blood vessels, etc. So things such as organs, let me just name organs because they're very important. And also let's say different um, regions regions of the body. So in short, in gross anatomy, they're going to study about the upper limb, the lower limb, pelvis, head and neck. Yes, so this is all about uh, gross anatomy. Now let's dive quickly into histology. So what do you expect in histology? So in histology, just like we said for gross, those structures that can be seen with our naked eyes. But with histology, it's just a study of tissues which can be seen under what? A microscope. So here talking about tissues under their microscope. Microscope. So this is all about histology. So instead of looking at the whole organ, so in histology, you're just simply looking at the organ is made up of mic- is the organ is made up of, the organ is made up of at a microscopic level. So examples of the thing that you should expect in histology. So you should expect epithelial tissues, epithelial tissue, connective tissues, muscle tissue, nervous tissue. So all those tissues which can be seen under the microscope, they all fall under histology. Yes. Then let's also dive quickly into embryology. Embryology. So so embryology, this one is a third component of the subdivision of anatomy. Remember, I've talked about gross, I've talked about histology as well. So embryology simply deals with human development. So let's say human development from fertilization, then through the development of what? The embryo and the fetus. So this is all about embryology. So we're going to learn um, how different organs develop and also the body structures, like how they develop. For example, of organs that you're going to learn about. For example, the heart. Going to learn about the heart, how the heart develops, nervous system, nervous system, the gastrointestinal tract, all the organs, the respiratory tract, the limbs. Simply are going to learn everything, like development of everything. So this is all about anatomy. We're done. Let's quickly dive into physiology. Physiology is another course. Physiology. Now get this. So if anatomy asks what is the structure? For example, let's say the structure is the heart. What is the structure? That's anatomy saying. Anatomy is saying what is the structure? Then the answer is the structure is the heart. Then physiology will say how does it work? So physiology will say how does it work? So simply physiology is just a study of how human body functions. So this is all about physiology. So you're going to learn how the human body functions. So you're going to learn about different body systems and also how they maintain normal function. So you're going to learn about different body systems and also how they maintain like how they maintain normal functions. So in short, you're going to learn about vascular physiology, you're going to learn about respiratory physiology, going to learn about nervous physiology. So this is all about physiology. So remember, anatomy is structure. Then physiology, you're simply dealing with the function of organ, function of an organ. Yeah. Now let's quickly dive into biochemistry. So biochemistry is also one of the major course that you should expect in your second year as a medical student. So biochemistry. So biochemistry. So in biochemistry, you're simply looking at medicine from a molecular. So you're looking at medicine from a molecular and chemical level. And yeah, chemical level. So this is all about biochemistry. You're just looking at medicine at molecular and chemical level. So biochemistry simply just focuses on the chemical processes which are occurring inside the living organisms, So topics that are going to encounter. So you're going to encounter topics such as carbohydrates, the enzymes, proteins, uh, maybe DNA and RNA, energy production, which is very, very important, energy production, vitamins, metabolism, very, very important. So guys, so this is all about physiology. So you're going to learn pathways, going to learn different pathways which are involved, for example, in glycolysis, um, talk of Krebs cycle, and also maybe let's talk about electron transport chain. So this is all about biochemistry in a nutshell. So these are just some of the metabolic pathways of biochemistry, but there are quite a lot of pathways. But these are the most important ones. So now let's now talk about the last course, which is public health. It is also very, very important. Public health. Okay. So public health, this one is quite different from other courses because it is not only, in short, you're not only focusing on you're not only focusing on individual patient, but here you're looking at, or rather, maybe let me put it as you're thinking about the communities. So you're thinking about the communities and populations. So this is all about public health. You're looking at communities and also populations. So you will learn about things such as health, epidemiology, very, very important, epidemiology, uh, screening, how do you screen different, maybe even community health, community health, etc. Yeah, a lot of things that talk about. But most important in biochemistry, you encounter biostatistics, biostatistics, which is very, very important. Yeah, but this would depend on your curriculum. Some they learn it in third year, and some they learn it in second year. So this is all about uh, courses in your second year as MBChB student. If you have any if you have any question, you can WhatsApp me on +2609778500412, and then I'll be able to attach to you. Thank you very much for your attention. If you want more videos, you can follow the channel. Then see you